So in order to put a muzzle on a dog, you have to get the appropriate size muzzle. And this dog is actually aggressive, so I'm going to come from behind while my assistant is holding the leash up so that it can't turn very easily. Like I said, I come from behind very quickly, and I slip the muzzle over the nose, and then clamp it behind the ears and make sure the ears are out. And now this dog is appropriately muzzled. It can try and claw this off, so you still have to control the head. I'm going to be using a restraint pull to restrain this dog. So today I'm going to use a towel to help restrain this kitty cat. What I like to do is place them in the center of the towel and hold their legs so that they can't get their legs out. And then I wrap it pretty tightly around their shoulder blade area. And that allows their legs to keep from pushing out. And then I wrap their rear end and their back legs up in the towel so that there's no kicking. And then you can flip them upside down and get any sort of samples that you need from the neck, or you can allow one or two legs to pop out if you want a back leg to apply a catheter. To start with our catheterization for urine collection, I have a solution of Chlorohex, and I'm going to wash the prepuce. I'm going to just flush 5 mLs, and then I'm going to follow up with a warm water solution. Another 5 mLs, and allow that to flush out. We're going to expose the penis, and we are going to then flush that with another solution of Chlorohex and follow it up with water, warm water. I then will switch to sterile gloves. And then I'm going to open up my catheter so that I can sterilely grab that once I am gloved up. Now I will sterilely grab my catheter, and I will apply sterile lubricant to the tip of the catheter. I'm then going to direct it into the opening, and I know about how far I need to go to reach the urinary bladder, so I will direct it slowly, making sure that if I feel any resistance, to try and redirect. Once I achieve the length that I need, I will then take my sterile needle, my sterile syringe, and attach it to my catheter and aspirate. And there's my flow of urine into the syringe, about enough for a UPC or a urinalysis. I will then slowly remove my catheter, and that is it. So when we collect free catch urine from a dog for a UA analysis or something similar to that, we just walk them with a ladle and a syringe until they urinate, and we'll try and collect the midstream rather than the beginning or the the stream. And then we do have to note that there's going to be extra bacteria in the sample just by the nature of the collection. And then there also might be debris from the ladle, from the syringe, anything like that can affect the results. Oh, hi, Katie. So now that she's produced some urine, we'll just collect it out of the syringe, or out of the ladle with the syringe. And that is our urine collection.
Leo's in beyond 1 or 2.
Okay. I'm going to scruff and stretch our cap for our cysto. I'm scruffing and then bracing the back against my forearm. And Dr. Pavantak's isolating the bladder. And with a 1.5 inch needle, we are aspirating for urine. And now we will do our UA. Good job, Hash Brown. Okay, so we're going to express the anal glands today. I have a little bit of lube on a gloved hand, and the anal glands are located at about 7 o'clock and 5 o'clock on a clock face. I reach in and they're about the size of a grape, maybe a little bit smaller on a small dog like this, and I express from the back forward slowly until I can get the anal gland to express. This dog's anal glands are a little bit just slightly impacted. It's a little bit of a thicker substance that's coming out of them. Usually it's pure liquid. The consistency is something you should check for while you're expressing. So with this dog, the thicker consistency is something I would note and let the doctor know about. Although there's not blood, there's not anything abnormal about the smell. And then I'll go in and do the 5 o'clock anal gland. We'll then wash off the rear end a little bit so that the dog doesn't smell like anal glands when it goes back up to its owners. With some lukewarm water and some shampoo. We're going to trim this puppy's nails today. So it's pretty easy with this dog's nails. I just grasp the foot firmly but not too hard, and then I look for my quick, and then I make sure not to trim my quick, and I just trim off the top portion. Now if you have a black nail, which I don't think we have on this dog, I would just look for the anatomy of the nail. I would look at where the nail starts to taper off, and just that tip I'm able to trim off. So we're gonna trim Kobu's back nails. He doesn't have front claws, so we're just gonna do the back ones today. It's very similar to a dog, as in you only take the tip off, but you actually have to extend. So I grab each toe and I push, and it allows the nail to be extended out. So I grab it at the toe pad, the paw pad, and at the top of the toe, and I push until that nail is extended, and then I'll trim just the end tip. So we are going to manually pill with Capstar, this puppy dog here. It is a nice dog, so I'm comfortable using my hands for this. I grab behind the canines and use that to start prying the mouth slightly open, and then I just shove the pill to the back of the mouth and make sure that we swallow. If we don't swallow, I would hold the mouth closed slightly and then blow on the nostrils just until it forms that reflex to swallow. We are going to hand pill Hash Brown today. With our hand pill, I have a hand pilling device, and then I also have a flush of water to help the pill go down a little bit easier since they don't have as many salivary glands as dogs do. So I simply open up the mouth and place the pill towards the back, and then flush with a little bit of water, and then hold the mouth closed and give a little bit of more water at the end. For Rudy today, we're going to be cleaning and medicating ears. Now, Rudy does not need her ears medicated, so instead of medicating with something like Mometamax, which is here, we're going to simulate it with more ear cleaner. I'm going to show you what it would be like to medicate, and then off camera I will then clean that ear cleaner out of her ears. But for the sake of this video, we're going to simulate it since she does not need any medication in her ears. We'll put the nozzle of our ear cleaner into that ear canal and squeeze until it fills up a little bit, and then I just kind of allow it to sink in and suds up just slightly. I'll initially take gauze just to get all of the large debris and all of that excess cleaner, and just start to massage it around all the folds in the ear, gently, not causing any pain. and it gets out an initial amount of dirt. From there, I will go in with our Q-tips and then go in the folds and all the small little crevices and just try and get out any sort of debris that's in here. Rudy's ears are pretty clean. And I'm also using this to absorb that extra ear cleaner. We don't want excess cleaner sitting down in the ear. Again, I'll take some gauze, get the excess cleaner out, and just massage all the folds and the crevices until I get a decently clean gauze pad. And I'm satisfied that most of the dirt and debris is out of the ear canal. So now what we would do is we would dose the medication per instructions. Usually it's 4 drops into the affected ear. What you would do is take the lid off and then put that down into the actual ear canal and squeeze the 4 drops out, remove it, and then massage the ear slightly. But like I said, I'm going to simulate with more ear cleaner because Rudy does not need any medication at this point. So again, I hold it up, I insert that nozzle, and I squeeze 4 drops out. And with normal medication, I would just massage it and let gravity do the work. The warmth of the ear would liquefy the medication even more, and it would slowly sink down. And that would be the end of it. You would just let that medication sit in there until the next dosing period. Once the debris and all the gunk is out, that medication can really go in and do all the work for you. But because that was ear cleaner that I put in, I'm going to remove it off of camera. Okay, so when we clean a cat's ears, we basically apply a little cleaner to an ear swab and then add some to the ear as well. It's okay, Dot. And once that's there, I like to just absorb some of the liquid with the gauze pad, and then I'll start to clean out the crevices of the ear, wiping upwards and gently until all of the debris is out of the ear. And then I'll take a Q-tip to absorb some of the extra moisture and to get all the little crevices so that there's no buildup or debris. So the medication we apply can do its job. When we talk about using medication, with something like Mildamycin, you're putting the entire amount into the ear. So you just drop that down towards the ear canal and then start to squeeze until it all comes out into the ear. And then once that's done, I just let it soak in and sink down. And that would be how to clean and medicate a cat's ears. When we talk about putting on a topical application of any sort of medication, we usually have a seal that we need to break. So that seal is broken, and then with this particular product, it comes out of the tip here so that you don't have to touch the product. I usually just push some fur between the shoulder blades up a little so I have access to the skin, and then all in one location I just squeeze the rest of the product out. And once that product is on the dog, in this case it's a lot, you allow it to dry, and once it's dry, the dog can go back to its normal activities. If there's kids in the household, we recommend waiting 2 hours for them to play. I always tell the owner just to let them hang out in the kennel until it's dry, and then they can come back out. We're performing gastric intubation on this dog. We're actually going to use this esophageal stethoscope. So in order to do this, I'm going to open up the mouth until I can see down the throat. Our intubation tube is in the trachea, so I'm going to go to the left of it. And to the left of it, I will find the esophagus, and I'll be able to position the esophageal stethoscope measure to a specific length down to the apex of the heart, and I will be able to read it on our monitor when it's in the right position. So now that I'm at the length of the tube down to the apex of the heart, I'm just going to let it sit there until it starts to read on my screen, and I'm getting a proper QRST reading, and that lets me know that I'm appropriately positioned and I'm getting a proper reading. I also always try to line up the heart rate that I'm feeling with the heart rate on the monitor to make sure that it is We are doing some ocular testing on this dog here. We're going to start with our pressures in both eyes, and then we're going to move to our tear test so that it doesn't affect, so that our fluorescein test doesn't affect our tear production. And then we will go on to check for corneal defects with our fluorescein test. So I just aseptically loaded our probe, and I am now going to take 6 readings in a single eye, and it'll average out and give me the pressure. So once I get close to the eye, I will hit the button, and it will either read or it'll give me an error, and I'll have to do it again. So I got 6 readings, and I got a pressure of 22, so I'll document that for the left eye. And then I will also do the right eye. Now we will do our Schirmer tear tests. These are going to sit on the eye for a total of 1 minute, and then we will read the measurement of tear production at the end of that 1 minute. We have our left test here. We will do our left eye. So I will look at my clock, and I will then place this on the eye, and then in 1 minute I will, now that we are at a minute, I will remove our test. I will read the number, which is at about 15 exactly, and I will record that for our eye, and I will repeat the steps in the other eye. And finally, we will use our fluorescein staining to check for any defects, scratches, ulcers, anything like that. So what I have here is a sterile syringe that I put 1 ml of water into. I will add my stain. We'll get a nice solution, and I will then drop that all into the eye. So it coats the eye. We will then be able to use a particular type of light, and the doctor will be able to see any scratching or staining to the eye. Anything that the stain picks up on is a corneal defect, and then we'll clean up our fur and let the owners know that sometimes some of that drainage will come out the nose, and that a bright green discharge from the nostrils is not abnormal. So today we're preparing an enema. What I did is I ran some lukewarm water, definitely not hot, definitely not cold, and I pulled up 50 mLs, which is the amount we want to do today, and I'm adding 3 mLs of Ajax dish detergent and mixing that into a small soapy diluted concoction, and then I'm going to suck that back into my 50 ml syringe. And once I have that, we will infuse this into our solution. We have our diluted dish detergent solution that we are going to inject into the rectum. It is lukewarm. We're going to push it flush. Is that working? Okay. And we're going to infuse it slowly. And I'm going to watch out for my face because sometimes it will flush back. We're just infusing that slowly into the rectum. Today we're going to do some sub-Q fluids on Buddy. Buddy is going to get 200 mLs of fluids, which this bag has exactly what our doctor wants to give, so we're just going to finish off this bag. We put it into this pressurized cup. We're going to inflate it until the pressure reaches the green line on our gauge, and that'll allow the fluids to come out quicker.
You basically need things that are going to make it.
Once we get it all inflated, we will be able to administer the fluids sub-Q into the connective tissue underneath the skin, right in between the shoulder blades. It'll create a camel-like hump that will disperse over the next couple of hours, and our patient will absorb the fluids more slowly than giving something IV. So now that our pressure cuff is pressurized, I'm taking a fresh needle that I just changed out for this patient, and I'm going to make a tent just like I would with a vaccine. And I'm going to insert the needle right into that tent and then start our fluids. And like I said, slowly it'll create a hump. If it gets too tight, I'll move to another.
Okay, good deal. So, literally, it's 2 o'clock. I don't know what your schedule's like.
Okay, so now that our 200 mLs of fluids are complete, I'm going to turn off our fluid line, and then I'm going to gently. Okay, so this dog is still intubated, so if it starts to wake up and swallow, I will remove that intubation tube. But in the meantime, we're going to do a simulated, modified Robert Jones bandage. We're not doing a splint, we're just going to do the bandage on this pup. The first step that I'm going to do is I'm going to apply a stirrup to the leg, which will help adhere it and keep it from falling down. So I apply it to one side of the leg, and I use our tongue depressor as a way to pull it apart so that it doesn't get stuck together. And on the other aspect of the leg. Now I will begin to use our cotton, and I will wrap this distally to the proximal end, and that's going to allow all of the blood to travel up towards the body instead of getting caught at the end and causing any sort of swelling. 2 middle toes slightly exposed to check for any swelling throughout the procedure, or throughout the time that the bandage is on. And I will actually roll this up a little bit. I'm going to cross the cotton over 50% of the previous cotton that I wrapped, and I'm going to do that in the same direction all the way up the leg. So I'm just overlapping 50% each time until I reach up over the elbow. And I try to make sure that there's no folds, which can cause damage to the tissue underneath all of this padding, especially up at the We're almost done, buddy. So at the end, I just tear off that cotton and sit it there. I will now use the compression gauze. This doesn't need to be very tight. It's just a way of compressing down this cotton a little bit. And again, I'm gonna roll it 50% over the previous, and I'm gonna start distally and work to my proximal end. And I'm working in the same direction that I rolled the cotton. And I'm gonna leave that cotton exposed, the gauze all the way to the top. I'm just gonna leave the cotton exposed. The same with our vet wrap. So now that that's there, we'll apply our stirrups. So I'm gonna peel them off of the tongue depressor. Twist and apply to the same side. We're almost done, Moses. And now the vet wrap. And the final vet wrap goes over everything. And I'm gonna leave the cotton at the end. And I'm working to not make this too tight. So I'm not pulling as I go. I just pull what I need and I wrap gently around. I pull out what I need. I wrap gently around. And then I continue in that 50% motion that I did on the rest of the leg. Close this one again. Good boy. And allow it to cover up the gauze, but I'm going to leave the cotton visible. And I tear that off, and we are done with our bandage. I know, buddy. It's almost over. Possibly. And that is our bandage. Our toes are visible to use as inspection. So down here you'll be able to see that we can see our toes. The modified Robert Jones bandage. I'm going to simply take my bandage scissors and get them on the lateral aspect of the leg and then cut through all of our cotton, all of our gauze, and all of our vet wrap. And if I get stuck at any point, I'll try and fit that safety end and take it off in one foul swoop. And it'll come off just like that. And then our initial stirrups we'll be able to pull off. We are starting with a modified Robert Jones bandage, and we're going to turn it into a splint. We're basically just going to add a splint to it. The modified Robert Jones makes that pretty easy. So we start out the exact same way. I'm going to get a longer stirrup than that. We start out the exact same way we would for the bandage, and then we add a splint in between our second and our third and fourth layers. We use the tongue depressor as a way to keep the stirrups separated so that we can then turn them and use them to hold up the splint. So once those stirrups are in place, we'll start with a layer of cotton padding to help with the comfort of the splint. We allow these two middle toes to be just barely visible, and that's going to allow us to check for swelling or irritation daily while the splint is in place. And then we start with our wrapping of the cotton. We go 50% of the layer previous, and we wrap all the way up proximal to the elbow. This is snug, but it's not tight. We are going to add some clean gauze after this that's going to kind of cinch things down, but we don't want this too tight. We don't want any folds. Or excess padding in one area and not in another, because it's just going to cause pressure and tissue damage potentially. So we keep it very even. We keep the same spacing between each roll, and we follow that up the limb. We work distally to proximally so that we don't trap any blood at the base of the foot, causing swelling. The cotton layer is going to stick out on both ends when the splint and the final wrap is placed. You will still be able to see this cotton layer, and that's going to allow the best comfort for the patient. So as we continue to wrap this, we're going to just finish out this roll proximal to the elbow. So now that we've got that in place, we're gonna go with our clean gauze, and start at the base again in the same manner. And we're gonna leave just a little bit of cotton padding out on the end for comfort. And again, we're gonna go 50% of each previous fold so that it's not uneven.
Anyway, knee and jeans.
Yeah, I'm gonna do that.
And we follow that all the way up the leg, applying some tension, but still not very tight. Once we get to
Oh, okay.
so now that we have our clean gauze, we just cut that. And now we apply our stirrups to hold everything in place and hold it up. So I take these and I twist and I pull upwards. Each side of the leg, trying not to keep any lumps or bumps, making it very smooth. We line up our caudal splint, and it allows the toes to be present on the back side. Now, because this splint doesn't cover the entire leg, we take care not to pull this too tightly, but we do want to secure it in place. So the same 50% rule applies. And once that is secure, we'll add our final layer of our vet wrap. I pull my vet wrap out and then I place it over so that I'm not tightening it. If I just tighten it like that, if I pull it all the way around without kind of giving it some bounce back, it's going to be a little bit too tight on the leg. So I pull out the length I need and then I wrap around gently. And that'll hold everything in place while not making the splint too tight. And again, the 50% rule applies, following 50% of the wrap before it. All the way. That's the leg. And just a little bit more at the proximal end to make sure that it's staying in place. And I start in the exact same direction as the way I was previously going, and I still place it 50% above where I was. And I make sure that this cotton at the end is still present. I don't want that to overlap because then the patient's going to get a little uncomfortable. So that final wrap is all we need. We can make sure all of it's nice and smooth. We are now going to remove this splint. We remove it the same way that we do the regular bandage. So we get underneath all layers and we just cut all the way down, being careful of excess skin or tissue. And then it'll just slide off, and then the stirrups you can pull down and off of the leg. We're going to be applying an emergency pressure bandage to this dog. It just had surgery and there's a little bit of bleeding, so we are going to apply a bandage just to get it to stop for a minute. The first thing we're going to do is apply some nitrofurazone. So I'm going to take some nitrofurazone to apply to the gauze, just so that the wound and the blood doesn't stick to the gauze, making the removal of this bandage complicated. This will just allow it to have a nice smooth surface to be removed. So we apply that to the wound, and then I take my cotton padding, and because this is around the abdomen, we don't want to make it very tight because breathing would be inhibited. So just a gentle wrap around the abdomen. And then we're going to follow up with our vet wrap. This can be done after mass removals where there's a lot of blood vessels involved and there's just some wound bleeding. Usually with spays like this it's not necessary, but for this video we're going to go ahead and show it. But this is a very common method to use after mass removals. Okay. And so that's not too tight. I can still fit a finger under it, but it's going to create some pressure on that wound. Okay, and now we're going to remove this bandage. So we like to take it off all in one cut. We don't like to take it off layer by layer. So I just put my bandage scissors underneath it. I make sure that there's no skin involved, and I just slice it down the middle, and it'll just peel away. And like I said before with the nitrofurazone, it makes easy removal of that bandage so that there's no sticking or tearing. When dealing with triaging an emergency patient, you begin by taking a quick assessment of the main risks, so respiratory, cardiovascular, and then neurologic. You can kind of do all of this at once. First, you're going to kind of note the respiratory issues, so how she's breathing, if she's breathing heavily, panting, shallow, deep breaths, anything like that. We'll take a look at her mucous membranes to see the color of those, and then we'll also check the CRT, or the capillary response time, to see how quickly blood is flowing back to the area. We also want to listen to the heart and lungs, listen for any crackling and abnormalities. And then once we listen to that, now if her mucous membranes are not pink, but grayish or blue or purple in any color, we would immediately put her on oxygen. But pink membranes does not necessarily mean everything's good. You also have to account for bright red. Temperature is also taken at this time. And then as far as our cardiovascular, we feel for the pulse. We make sure that that is in line with our heartbeats. We take the beats per minute and we record that. And we also check for neurological responses. So we look at the pupils, we check mentation, just how she's acting, how alert she is, if she's dull, and then we can check gait if she's willing to walk. Aside from that, that's kind of our basic assessment. We write all of that down and take into account if we need to start oxygen or any other supplemental care. And from there, if we were addressing an open wound, we would clip and shave the area around the wound. We would first put water-soluble sterile lubricant in the wound, clip around it, and then wipe away that lube and the extra hair so that the hair doesn't get into the wound. And then just for a bandage, a temporary bandage, we would add nitrofurazone to a gauze pad, apply that to the wound so that our gauze doesn't get stuck to the wound when we later remove it, and then we would wrap it in vet wrap, snugly but not tightly, just to stop any bleeding and keep that closed and closed off against bacteria in the air until we can further treat it. But that is kind of a basic triage. With this dental procedure, we start out by taking pictures for the client. So we have everything set up for monitoring. We're hooked up to our appropriate dosages of ISO and oxygen. And now that we begin the cleaning itself, I start by taking the pictures so that the owner has a before and after to show value. I have my appropriate safety gear on, gloves, mask, and goggles. So like I explained, I like to hold my scaler like this. This is a good tooth to show because all of this pink is that red coat stain, so we'll be able to see that being removed. We try not to spend too much time on one tooth, so I start my scaler and I very quickly and gradually scale off the plaque and the staining, and scale tooth, go. So I'm using my hand tools to get underneath the gum line to pull out any sort of plaque or tartar. These curved curettes allow me to go up under the gum line and then pull down any plaque or tartar that's in there. And then I also have my probe that's allowing me to check for pockets. I will do this on all surfaces of every tooth in the mouth. Our polishing paste here, this actually has fluoride in it, so we won't have to do a fluoride wash at the end. What this is going to do is all of those little tiny crevices and abrasions that I just caused with the scaler, those attract plaque and tartar buildup, so this is going to polish that down smooth so that the plaque and tartar doesn't have as healthy of a surface to grab a hold of. I'm going to place the polishing head on the tooth and slowly press down on my pedal and coat all surfaces that I just polished, or that I just scaled with the polish. After dental cleanings, we like to go over at-home dental care with our clients so that their dental cleanings are more effective. We can go a little bit longer in between dental cleanings and the teeth stay healthier, and that the plaque and tartar doesn't build up excessively between those dental cleanings, making each dental cleaning less expensive, also less time, and therefore safer and more effective. So the main things that we talk about post-dental care is really just making sure that we don't build up plaque and tartar. So brushing the teeth with veterinary enzymatic toothpaste is the best way of preventing plaque and tartar. We let our clients know that this is something that they need to be doing every day, if not every other day at minimum. Plaque turns to tartar in 72 hours, and you cannot brush tartar away. So if you're not doing this at least every 72 hours, it's not doing any good. But we usually send home these brushes with puppies so they can start getting into the habit of brushing the teeth with the small end, and then as the puppy grows up we can start brushing with the larger end. And then we'll also send out little samples of our toothpaste, and they can come back and buy the bottles from us if they can make it a habit. From there, we also suggest treats, so rawhides that actually mechanically help prevent plaque and tartar buildup, as well as TD type dental food. These large kibbles allow for the mechanical action of breaking down some of that plaque and tartar. These foods help, but they're not going to prevent the plaque and tartar. It's just going to act as a way of keeping it away longer, but it's not actually going to prevent anything. And then we also have these new Oravet chews. These Oravet chews have a drug called Delmopanol in them, and it actually coats the gingiva, the teeth, and it helps protect against the plaque and tartar buildup, and it can also start to break that down if we use it over time. We like to give these out daily, and then if they don't want to do them daily, we actually recommend doing them 3 to 4 weeks before a dental cleaning so that some of that plaque and tartar is being broken down, and then we can go in and everything's a little bit looser, it's a little bit easier to get off. So these are wonderful treats before dental procedures. And then finally, DentaHex oral rinse, just our regular Chlorohex rinse. This is wonderful after mealtime to just lift up the gingiva, spray on the teeth, and it helps coat everything and get some of that plaque and tartar and the bacteria that causes that to calm down a little bit. Overall, we do still recommend dental cleanings regularly, but these products can help prolong how long in between a dental cleaning we can go, and then it also keeps the gingiva and the teeth healthier so that when we go in and we do clean off the plaque and tartar, there's less bleeding, less irritation, and then usually less bone loss.